So welcome everybody. Thank you, Angela and Leslie, for joining us. It is so great to see you both. I'm excited to have this conversation with both of you this evening. I wanted to get into a little bit of information that I wanted to share. I did have something open and it is closed. So hang on just a moment as I pull that back up. I'm going to drop this into the chat once I'm finished. It is a Rural Policy Research Institute study that I think is really, they did a great job with it. So I'll drop this document into the chat if you want to check it out. It's all about ambulance services. And they have some really good literature in here about rural EMS because their whole focus is rural. So every year, nearly 10 million rural Americans receive EMS care. And there are roughly 23,272 ambulance agencies in the US as of 2021. And 73% of those agencies report serving rural areas. So the Rural Policy Institute did this study. They looked at ambulance services and they came up with some key findings. And I'm going to share those key findings with you. And this will really set the stage for a really good conversation. So key findings that they found is that rural ambulance agencies, they have longer distances and challenging terrain that prolong emergency response and transport times. What the research found is there's insufficient payment by insurers to cover standby and fixed costs. Other findings, a changing workforce that has historically relied on volunteers, but increasingly must include paid personnel, a lack of regional EMS plans to coordinate services, and insufficient state and federal policy coordination across oversight agencies. So specific public policies to address. So after doing this research, these are the things that they came up with. Rural ambulance agency challenges could include the following. So these are their suggestions, basically, their policy suggestions to address. Increase ambulance payment to adequately cover reasonable standby and fixed costs. Consider EMS as essential service, the same as firefighting and law enforcement. Collect rural ambulance agency workforce data to better understand workforce needs, which is a lot of actually the things we're focusing on in Michigan. Whoop, whoop. Expand the scope and authority of federal interagency committee on EMS to address rural ambulance agency payment and workforce challenges. So this kind of sets the stage for some of the challenges and some of the policy issues that, that the Policy Institute identified that need to be addressed. As I said, I'll drop this in the chat here in just a few moments. But we know that our rural EMS agencies face similar and unique challenges. And today's discussion really centers around what we can do and also learning more about what the Michigan Association of Ambulance Services is currently doing, their initiatives, and what the Michigan Rural EMS Network is currently doing in their initiatives. So with that, I'll kind of just take us right into the first question, and this is posed to both of you guys. Tell us about your organization. What is your mission? And what are the EMS initiatives in Michigan EMS professionals should be aware of? So feel free, Leslie or Angela, whoever wants to go first, you're more than welcome.
I'm happy to, and I'll keep it short because I don't know how much time allotted to each question. I'll keep it as succinct as possible. But the mission of Michigan Rural EMS Network is to provide programs and resources that strengthen EMS systems in Michigan, resulting in improved practices and outcomes. And that is a new and revamped mission for us coming into 2023. Not a far cry from our initial mission, but we are evolving just as the EMS landscape is evolving. We have, so our history goes back to 2003, and it actually involves Michigan Center for Rural Health. Our organization was started because there were 9 EMS agencies in the Thumb area of Michigan, 2 counties, which were Huron and Sanilac counties, that understood that there were issues with recruitment of EMS professionals into their agencies, and they wanted to get together to see how they could work together to address what they knew was going to be a shortage. The current workforce was aging, and not enough people were coming up in the ranks. And so they got together as just an informal task force and ended up receiving some seed money from Michigan Center for Rural Health to kind of fund some of their activities and outreach through that task force. When I was brought in 2007, they were working on an outreach grant for recruitment and retention, and doing some distance learning in high schools, and some other community outreach initiatives to educate the public about the importance of EMS and to help recruit new folks into education programs and garner interest in going into the field. And when I came on board, we put some organizational development behind that. And so we became a 501c3. We were called the Huron-Sanilac EMS Network. So we continued to work on recruitment and retention. And we had some really great outcomes from some 2 grant initiatives that were ongoing at that time. And people around the state started to hear about the impact that we were having in those 2 counties, and said we could use an organization that is solely dedicated to rural EMS issues in Michigan. There were other agencies, and there still are other agencies that are working in the rural EMS arena and advocating on behalf of rural EMS agencies and professionals, but not one agency solely dedicated to it. And so we were blessed with some federal funding to expand our network to a statewide network in 2012 is when we began that process and became the Michigan Rural EMS Network. And so again, a 501c3 dedicated to making an impact and a difference in for rural agencies and professionals across all of rural Michigan. And did you want me to wait to talk about initiatives or just head right into that?
You're more than welcome to head. It's totally up to you guys. We can let it flow, or you can head right into it, whatever you prefer.
I'll just do a quick overview, and then if there may be questions, and I hope that there are, and I can go into more detail then. We have several initiatives that we're working on now currently through some different grant-funded programs, and we have other initiatives that we have continued to work on and work to sustain. One you may have heard of was a large rural high-performance CPR initiative that we rolled out in, I think, oh geez, was it? It's been a long time now. That's probably been 6 years now. We still are able to provide those services training in rural areas in high-performance CPR. We continue to work on our recruitment and retention initiatives where our roots are. We are working on a FEMA project, a FEMA Safer project. It's our 3rd award in cooperation or in collaboration with Northern Michigan Fire Chiefs Association. And so we are doing several things through that initiative. You may see now we've got billboards popping up all over the Northern Michigan Fire Chiefs Association region from M46 north to the bridge. And so we have some recruitment, volunteer and combination fire recruitment billboards. We have radio spots that have aired and more that are coming. targeting different groups that may have an interest in becoming a trained firefighter and providing services in their community. We have a recruitment and retention toolkit as part of that initiative. We have resources for outreach by department available, lots and lots of resources. We have offered leadership training last fall, and we have another leadership training coming up in Traverse City area in August. And so those are some of the things we're doing with that SAFER initiative. We have a project called Beyond the Save that is has a Upper Peninsula focus, all 15 counties in the Upper Peninsula. I'm going to put a little plug in as part of that project. Last year we did a mental wellness conference for first responders, had great presenters from all over the country and one from Canada, talking about mental wellness and strategies and tools and resources for maintaining or mental wellness despite the stress of your position as a EMS professional or fire or law enforcement professional. And we're going to be having that conference again, August 24th and 25th in Marquette at Northern Michigan University. I'm going to throw our website in the chat when I'm not talking, and you can follow that for a thank you. You're so on it.
Yep. So you can click that link and check it out.
Thank you. And so Beyond the Save was really the first coordinated that I know of rural focused initiative to bring together behavioral health and EMS and find innovative ways to utilize EMS to not use them, but empower them to provide the best care in the field when they called on a behavioral health emergency. But not only that, and I guess also how to, we've been educating them about the necessary resources and what they do when they identify someone with a substance use disorder, either opioid or alcohol or what have you, how to get them the resources, the patient, the resources they need and help them get to treatment. And so, but not only that, the focus is not only on what they can do for the patients that they serve, but also how can they support one another as crewmates, as colleagues, and also take care of their own mental wellness needs, behavioral health needs. And so that's been a great opportunity. What we had found was that EMS was not, there were all these projects popping up to address the opioid crisis, and most often we found that EMS was not invited to those table discussions, and so we saw that need and wanted to bridge that gap, and it's been very successful and very fruitful, and something that I think will have a lasting impact, and that we hope to continue. We also have 3 concurrent mental health training grants right now, or training grants that have a mental health component, each of them through the Substance Abuse and Mental Health Services Administration. One of them that we are working on concurrently, 2 awards concurrently, you may have heard of, is the Rural EMS Training and Equipment Grant. That project is called My Siren. That's what we have coined the project. And we are providing initial education and in rural areas for the MFR and EMT level, as well as continuing education days or opportunities that individuals, agencies, or instructors want to put on in rural areas that didn't have the resources to do so. So we've been able to provide, gosh, I didn't write down the numbers, but I know just in the last 9 months or so, we've had 7 MFR and EMT courses that were completed. 3 are currently in progress and 2 more are scheduled. We are waiting to hear about funding on an additional year funding, and so we'll be able to offer more of that. So I hope that we can stay engaged after today, and that if you have a need in your community for continuing education and or some initial education, that we can help you with the resources for that. But included in those initiatives are a mental health training component. And so we are doing CE days based on, solely on some mental health issues. We are going to be putting on, they're in process right now, the planning process and being scheduled, but we've been providing mental health first aid training. We are going to be providing stress first aid training, and also the opportunity to become instructors. And we've also partnered with Anthony Pantaleo at the state, who has written the mental health and substance use disorder curriculum for the community paramedic program, that we're partnering with him to push out some of that training in rural areas, and also to certify instructors to provide that training as well, to help increase the impact that Anthony can have alone. So we're excited about that. We have so much going on. We're also doing some CISM training through those initiatives, as well as another field office initiative that we have going on. We are equipping some agencies that are strategically located throughout regional areas in Michigan with mobile training units to provide high performance CPR training, initial education programs, and continuing education programs. That's been a lot of fun. And we have also, and I'll talk a little bit more about this later, through these initiatives, the funding that has been provided to us, we've been able to contract to have some white papers written, one on recruitment and retention in rural Michigan, and 2 on behavioral health issues for EMS professionals, but really with a rural focus, which has been exciting. So that, in a nutshell, is what we're doing. And I apologize for talking quickly, but there's a lot going on. So
yeah,
that
sounds like a lot.
I'll give it to you, Angela.
Good for you. Good for you, Leslie. Thank you. Yeah, Angela. So tell us about your organization. What is your mission, and what are the EMS initiatives in Michigan EMS professionals should be aware of?
Yeah, just want to make sure everyone can hear me okay. My headphones decided to die mid there, so I had to make an audio switch, but it looks like there's some head nods, so great. So good evening, everyone. Again, my name is Angela Madden. I'm the Executive Director of the Michigan Association of Ambulance Service, or MAWS. MAWS is a 501c6, so a completely different type of entity than my REMS is. And the reason MAWS is set up as a 501c6 is because our mission, while it is to be a resource for EMS agencies all over the state, but the key component of our mission is advocacy at the state level, advocacy at the federal level, at the regulatory level, and at the legislative level. So across all kind of avenues of what we do. Given that that is the key component of our mission, I spend the majority of my time working with a team of lobbyists and public relations professionals to ensure that we are representing the industry to the best of our ability and representing what it means to be an EMS professional, what it means to be an EMS agency in all of our local communities, and the good work that the agencies and the MFRs and EMTs and paramedics are doing every single day out on the rig. As far as what are some current initiatives, all of them are legislative at the moment, but in key components, we do have an outreach campaign in the works, just like Leslie had mentioned. Ours will be statewide in focus, hopefully. That's a funding question that we're still waiting on. Other than that, we focus solely on the state side budget, or the state's budget just passed. So we've been really spending the majority of our spring and early summer ensuring that Medicaid reimbursements are appropriate. They're not, they're still not. That's still something we're working on. And we will continue to work on as we move forward. And then looking at some of the pieces of legislation that have already been dropped, maybe not timely. And I think that can be due to just having a majority legislators that haven't served and haven't led in that capacity before, and they made some oopsies, but hey, we got a little bit of notice on it, so that's great. Aside from that, we work hand in hand with a lot of the payers on our reimbursement committee. So if you happen to see, or an agency happens to see, that a certain payer is denying a lot of claims, our reimbursement committee looks at those, looks at the denial reasons, and then we go as a statewide organization to that payer. That way you don't have to, the agency doesn't have to do so independently, fear any retribution from that payer, and we can blind or group a lot of claim examples, and we can talk about it from a much more global perspective than an individual agency perspective. So it usually works out in everybody's favor. If one agency is having a problem with a payer, guaranteed there's another agency having that exact same problem. So we tend to work hand in hand. In fact, our reimbursement committee is the best attended committee that we have, and they do the most work, even over and above our legislative committee. Sometimes I feel like they get off easy. So what are some of the things that maybe I know, and I am skipping forward a question, but what are some initiatives we're involved in now, grassroots and legislative initiatives we're involved in now? I thought that this allowed me an opportunity to continue, Andrea, if that's okay. She's nodding. Okay, awesome. So one thing that you may or may not have noticed last week, Representative Brenda Carter, who's the chair of the House Insurance Committee, dropped a bill including ground ambulance and surprise billing regulations, including emergency and non-emergency patients. Not sure how a paramedic is going to be able to tell an unconscious emergency patient that their bill is going to be X amount for their transport to X hospital. But, you know, hey, the legislators seem to know better than us, so we're working through that right now. That is one of those bills that we were not supposed to get notice on. They were intending on dropping that late in September, having a hearing and moving it quick, so we didn't have time to organize. Shucks for them. Outside of that, we're looking at drafting, like Leslie mentioned, some essential service legislation. Just want to point out though, essential services only encompass charter townships, not general townships. We have a large number of municipal general townships here in our state, where even if we were deemed an essential service, we would still not be mandated to have those services provided in a general township. Only charter townships fall under our municipal act. So while I think overall the message there is that EMS needs to be held to the same standard as police and fire, meaning seen as essential, I think it's important that we do so. I just want everyone to know that even when we do legislatively, it still doesn't impact every single municipality in our state. Little catch-22 there.
So Angela, two things I wanted to be sure the audience understands, because I don't know if everybody here understands the surprise billing.
Yeah.
Would you be willing to just give like a brief, like just simple overview of what that means,
Sure.
that would be awesome.
Yeah, sure. So essentially, a surprise bill to a patient is any bill the patient receives post-service that they were not expecting. Okay, so in our world, we may call that a balance bill, but in the public's eye, it is a surprise bill. And so what we are finding, there is surprise billing legislation at the federal level and at our state level. The ground ambulance in particular has been exempted from those, mostly because of our inability to provide a reasonable expectation of what their surprise bill is going to be after the service is rendered. We can't, EMTALA does not allow you to ask for a patient's ability to pay. So we don't ask who their insurer is, okay? I also want to point out that a surprise bill is typically a surprise bill because patients don't know what their coverage is. They are underinsured as it relates to EMS. So that surprise bill is their deductible. It's their co-insurance. It is not the EMS, not necessarily the EMS agency billing an amount over and above that which they have already charged the payer, the commercial insurer, for example. Now, agencies under contract with that commercial payer are required to accept payment in full and not allowed to balance bill or surprise bill the patient. But I will tell you, there is, and I'm sorry if everybody can hear my dogs barking in the background. There is unfortunately a kind of a push, especially by the commercial payers, to not understand, intentionally, unintentionally, I don't want to put words in their mouth, that the cost of EMS business is the cost of readiness. It's no longer the cost of the transport itself when the wheels are turning, yet we're still getting reimbursed only for that time that the wheels are turning. So a story that was just relayed to me was in fact A0998, a treat no transport for a diabetic patient who was given a juice box. Vitals were taken, wife handed him a juice box and he signed the refused transport. Well, he was charged $500 for a treat no transport, which by the way, Blue Cross pays $463.98. So that charge was actually reasonable. It was actually a very reasonable charge for a treat no transport. Medicaid pays it, Blue Cross pays it, his insured didn't. And that is the example of a surprise bill. But something that if EMS agencies aren't able to collect at some point in the near future, it really hinders that agency's ability for them to provide high quality service to any patient in their service area. Not just that one patient who didn't need to be transported, but for them to continue to uphold that level of readiness and professionalism to respond to the cardiac arrest or the stroke or the STEMI, right? So it's extremely important for us that we maintain adequate reimbursement and adequate coverage while helping the general public to know. And remember, the general public has a knowledge span of about a kindergartner, maybe less, when it comes to their healthcare, that what they choose and how they choose to use their healthcare resources impacts the entire line of our healthcare continuum here in our state. So that's kind of surprise billing in a nutshell with an example.
That was excellent. Yeah, I thought you broke that down really well. And then the other plug I just wanted to throw in there with essential service is please read and understand what that means. Like, it doesn't mean additional funding. It doesn't either. There are a lot of nuances within that I didn't understand until I started looking at it as well. So yeah. So I just wanted to throw that plug in there. Really look at essential service before you make a decision on that one.
Yeah, and I think you could see in some communities that pay maybe a lower stipend to their EMS agencies. I think should EMS be deemed essential, should the state legislature really enforce what that contract might look at, you're going to see municipalities stop paying altogether. And I think it could both ways. We could have positive stuff with it. It could be detrimental, but I think what is important when we look at deeming EMS as essential, by the way, only 13 states in the country have EMS as an essential service. So we are in no means the minority there. We're in the majority of states that don't have EMS as an essential service. So, but I think it's important that we understand that not being named as an essential service does more, or at least the effort to become an essential service does more for EMS than maybe passing the legislation in total. The charter townships are probably already providing some level of stipend or some level of coverage via a contract with a private agency or with an MFR agency. So the townships that currently are likely those general townships that aren't going to add it anyway. But what we do get is that outreach, that publicity, that what the general public doesn't understand, that they're a municipality, they don't pay taxes to cover EMS, at least not in very many circumstances. And they think they do. So when they do get that surprise bill, they're surprised. Again, I think the majority of the surprise bills in our state aren't necessarily they shouldn't be a surprise. I think they're deductibles. If you're a typical healthy person, you probably you're only seeing maybe your PCP for your annual exams, which are covered, right, by the ACA. If you are a typical healthy person, maybe you sprain an ankle, maybe you get an x-ray, maybe you tear your gastroc and you need an MRI, and that's about it. But that one instance where you are involved in an auto accident and maybe you are unconscious for a few minutes and they do transport you to be observed in the ED, you have to remember that that ambulance trip is hitting your deductible. And because premiums are continuing to increase, high deductible health plans are also continuing to increase. So the higher your deductible is, the more of your medical bills are going to hit that, the more surprised you're going to be. Not because everybody, again, thinks that the ambulance is covered in the event of an emergency. It's not. So surprise billing and essential services kind of work together almost based on the general public's mind. If you put yourself outside of the EMS industry and into John Q. Public's brain, that's kind of where you end up. And then when you multiply that by 180 legislators who have this much, even less knowledge about it because their brains are being filled with a whole bunch of other information about other very important topic matters, then anybody can really convince them to do whatever they want them to do.
Could the future involve EMS not like being a covered service and not hinge on a deductible? Could that be possible?
100% it could be. 100%. Just like well visits and a lot of vaccinations for children ended up through the ACA as things that were not that are fully covered, that are mandated to be fully covered. I think the easiest way to accomplish that would be to accomplish it federally. I think the only way we can accomplish that federally is for us to be taken out of the Department of Transportation and put into the Department of Health, though.
Yeah. Excellent. So I know you had kind of moved into number 2. So you started with some of the grassroots.
Yeah.
Did you want to talk a little bit about what you feel are the most pressing issues facing EMS now?
Yeah, so I will, absolutely. I think there are 2 things, and I think they're both number 1, and it's reimbursement and it's recruitment and retention. Without reimbursement, you can't recruit more people. If you can't recruit more people, you can't do more trips, so you don't get more reimbursement. So, it's this really bad chicken and egg situation that we have, but I think there's a couple of things that we can do to help. I think EMD, if all of our communities were to take on EMD and we were able to dispatch a little bit better and ensure that we're sending the appropriate resources, that we're not sending an ALS truck to a sprained ankle so that ALS truck can go to the cardiac arrest that calls in 5 minutes later, would be a huge relief for us. I think we need to work on educating the general public that they need to utilize urgent cares and they need to utilize their PCPs, and they can't just call 911 or walk themselves into the ED, because our staffing at all levels of those is just going away. And if we don't learn as consumers of healthcare how to better utilize those resources, then I foresee our entire healthcare system crashing eventually. So
yeah. So with your EMD comment, I wanted to kind of just add something in there, maybe pick your brain a little bit. So I got into this really deep discussion the other day about this, because when I think of EMD, I think of like the large corporates that have these great dispatch centers. But when you're in a rural community, right, it goes to the sheriff department. It's really small. There typically is no EMD involved. And then I think about how many of them there are, right? And so I just get overwhelmed thinking about how would we do that? Because I think, you know, the larger corporates need obviously EMD just as bad as rural, but in a different way. Because instead of sending 6 trucks to the wrong or calls that don't need, right, you're sending 1 truck 3 hours somewhere that they don't need to be, or whatever it may be. So I think there's definitely like some thoughts and complexity behind how that would work and how it would be funded, and whether it's regionalization again or some bigger thought that would create that, I don't know.
Yeah, I'm not envisioning a full-scale EMD in rural communities. I am envisioning slightly, you know, maybe a little bit better training for the dispatchers of the sheriff's office to help, you know, because in some instances, remember, a Girl Scout with an AED trained to use that AED is still a response, right? So we can, a response in certain circumstances is better than pulling an inappropriate response. That's not a great example, so bear with me, everybody. So I think if we were to instruct or help better educate the rural dispatchers to really better understand the circumstances, I think the other part of that is that dispatcher knows that it's a sprained ankle, right? So I think we need to start setting the expectation for ourselves that we need to start telling the general public, we understand you need assistance. We are going to get you assistance, but it's going to be an hour. And if we are upfront with the general public about what the timeline is for them to get, because maybe that BLS truck is on a broken arm, right? So if we are upfront with that general public about their response time, and to start encouraging them to be aware of the fact that not every emergency needs an 8-minute response, that frees up our other resources for those emergencies. And by the way, medical outcomes, clinical outcomes really only dictate that it's 3: stroke, STEMI, and cardiac arrest. So everything else does not, capital N, capital O, capital T, need 8 minutes.
Yeah, for sure. Absolutely. Excellent. And did I cut you off? Was there anything else before we?
Nope, not at all. Yep.
Okay, perfect. So Leslie, what are your grassroots advocacy initiatives, and what do you feel are the most pressing EMS advocacy issues today?
Interest, as I said in the introduction, our organization was really founded as a grassroots movement, as it were, and so, but we continue to work on trying to positively impact recruitment and retention efforts in rural Michigan, both through our own outreach programs, but also in collaboration with other agencies. High Performance CPR was really founded as a grassroots initiative as well. And then, so as Angela was great at defining what her organization, her federal designation, and how that differs from Michigan Rural EMS Network. As a 501c3, we are not allowed to lobby, and we have to be somewhat careful about even advocacy with legislators that may look like advocacy, and not do that in a way that is funded by federal funds, because much of our funding comes from federal grants. And so staff time that's covered, we have to be very careful to pay it out of, our own operating funds and such. But some things that we are able to do to advocate on behalf of needs of rural agencies and EMS professionals are we seek to educate stakeholders, whether that's, businesses in your community or your community population or your local, state, or federal government, whatever that looks like. We regularly do needs assessments and surveying, and so we disseminate that information. We look for opportunities to disseminate that information through meetings and conferences, but we also look to disseminate that information in talks with other stakeholders, such as legislators. We have evaluation data from each of our grant-funded programs that we communicate regularly to the federal government, and we are working toward doing a better job about disseminating that information to other stakeholders that are not necessarily legislators, and certainly through the white papers that we have contracted for, that are a great tool for educating and advocating on behalf of rural needs, and some of the things that Angela just spoke about. But those things are available to you as well to go to your local government, to stakeholders in your area, and to your community, and say, hey, this is a formal paper that has been produced with federal dollars. This is important stuff. This has great data, so that you are aware of what our challenges are in rural Michigan, and where there are gaps that need to be filled, and what you can do, Mr. or Mrs. Legislator, or John Q. community member. These are some things that you can do to ensure that you have adequate emergency response in rural Michigan. So the most pressing, I'd have to agree with Angela. Obviously, recruitment and retention and reimbursement. I have a little bit longer list. I mean, obviously, those are the most pressing. I have, it all boils down, I guess, at the end of the day, to money, really. We need to provide a living wage that respects and recognizes the professional nature of your positions, and the education and the skill set that you have, and the good that you do for your community. We need to provide adequate reimbursement and benefits and such to keep you in your position, to allow you to have a work-life balance where you're not feeling like you have to work 3 jobs to support your family, and one that allows you to stay mentally well. We were promoting mental wellness, and it's a catch-22. Like Angela said, about the recruitment and retention and the funding. How do you stay mentally well when you don't have time for you or your family? I think that another huge pressing issue is just to have EMS recognized as being as essential in receiving funding that other emergency services do, just because they have historically. EMS is often not included in many of these funding opportunities at the federal level, and I think that I would love to see EMS become more mobilized and a larger voice for themselves. But my hope is that we get to a day when that federal funding, we don't have to advocate for it, and legislators are aware that it's a need, and it's just included in the budget as a practice, and that we don't have to advocate for additional funding for EMS. So those are the top on my list of most pressing issues for advocacy.
Great. Yeah. And I'm looking at the time and holy cow. So I'm going to skip ahead a little bit. And I'm going to move on to our question number, number 5, how can EMS professionals deepen their involvement with your organization? So how can they get connected, membership, no membership, connection? Angela, do you want to take this one first?
Sure, absolutely. There's a couple of different ways, right? So we are always looking for committee members. So I would, for anybody on the call that is an agency director, if you are interested in participating in any of the committees or looking more closely at any of the areas that we are focusing on, at least pick up the phone and give me a call. While I would very much appreciate your membership in the organization, there's always some, we'll call it wiggle room, right? And it's just a matter of getting people involved and understanding. One of the things, so I've been with Moz now, thanks for doing that, just over 7 years. And one of the things that was the extremely high priority for me, if you can imagine myself, so let me paint this picture for you very quickly. I am 5 foot, well, my driver's license is 2. And so I claim that I am 5'2". However, I am not 5'2". So I must have had some pretty thick shoes on that day, and I'm going to keep it, right? I am spunky, I will say, but I walked into a boardroom, 18 middle-aged white men, and that's not what our organization, that's not what our agencies look like today. So I have really taken it upon myself to ensure that our board of directors matches a little bit more closely the agency representation that is out there. Fully admit that that board used to be filled with all of the large actors. It is no longer filled with all of the large agencies in our state. They have a place, but so does everybody else. So that has been, and they've taken that very well. They've only had their hands slapped a couple of times. So that's something that I am actively working on, ensuring that we have representation from all the way across the state. And in fact, it makes me extremely proud to see our rural membership growing and becoming more active. I also realize that it is harder for agency directors to be active in an organization like mine because of the amount of work that they are required to do on a daily basis within their agency. I am a staff of 1. I totally understand that you might not have the capacity to be completely involved in a statewide trade association, or at least it's not your priority. But a couple of emails every now and then, answering a call to action when they go out. I will tell you, I personally think it's worth you $300 a year to get those email alerts in particular. Make sure I'm not, hitting your spam folder because we've got some really big ones that are going to be coming up in September. And, you have a lot of power. Rural agencies, especially with their legislative community, their local community, have a lot of power, And so it would, becoming active, reaching out to me, picking up the phone, call me. My office phone number rings to my cell phone, right? Anybody can have my cell phone number. You don't have to be a member to talk to me. You don't have to be a member to ask me a question about cost reporting, about a bill that's going through, about a conference that's coming up, anything. You can text me, you can call me, you can email me. I'm not going to not answer you because you haven't sent me a $300 check this year. That's not how I operate. The good of the whole is better than the good of one. And where one goes, we all go, typically in my book. So how do you deepen your involvement? Simple. If you want my cell phone number, I'll put it in the chat.
Cool. All right. We'll reach out, you guys. Awesome. Leslie, go ahead.
So we are not a membership-driven organization. We were at one time, but we are not at this time. I don't know if that'll change in the future, but Right now, we are not. Some ways that you can deepen your involvement with us, I would say, there's active ways to do that and inactive ways or less active ways to do that. So I think we have something for everyone, whether, you're, outgoing or you're more like reserved and late or like to stay behind the scenes. But one great way is when you see a needs assessment, maybe come through your email or to your agency or your director, it trickles down to you to fill those out, because we base all of our programming on strategic planning by our board of directors that is based on these needs assessments and surveys that we do. So without your voice, we don't know what you need, and we don't want to assume what you need. And so those needs assessments are really great ways to be able to do that. And I do have a new needs assessment, some data coming out. It should be before, well, it was promised before August 1st, but it's almost there. The data is being compiled and into a report, but in the next few weeks. So if you want to take a look at that and share that, or if it would help you with a grant application, whatever, please get a hold of me. I would say another great way is to participate in educational offerings, or let us know if you have a need for a certain education in your area. And, we would love to come beside you and help you figure out how to do that if you don't have the funds to do it. You can engage with us on social media, follow us, share our posts, let people know about our conference. We may get back to where we're doing a regular continuing education conference. We used to do EMS Summit yearly, and it ended up being for several years in Frankenmuth. We may get back to that. So just sharing the word and opportunities that are available. And that helps us not only show value for, the funds that we've been granted, and but it helps us make a case for funds to be available at the federal level and the state level, and even at the foundation level, that are needed to support rural EMS. And if people aren't participating in education, we can't say this was needed or this had this huge impact that we were hoping. And so participating in those things is a great way to show your support. I would say, invite me to opportunities to sit in meetings with you, to sit with your leadership, to sit with your medical control, to share our information, but also to share information with me about the needs in your region. You are the experts on what your region needs, or what your agency needs, or what you as an individual needs. And so without that information, we sometimes make assumptions. And so call me, let's do lunch, let's sit down. If you're passionate about something and you want to figure out how can we work together to get this funded, or how can we, with some of the funds that we already have, help to meet those needs, let us know. I'd love to sit down with you. That's where the fun happens. I think that there's so much more collaboration that's happening between our three agencies, and I love where we have come from and where we are now. And I think as we continue to collaborate and you collaborate with each of our agencies, that our impact can be much larger. Let's leverage what we all have. We all bring something unique to the table, and we have some similarities, but we have a lot of differences. And so reach out and ask, hey, I want to be involved. Is there something you need? And I think we'll find a way for that to work out. So thank you.
Excellent. Yeah. And we are at 6:55. So I'm going to open up the floor for questions. So feel free to use the chat. You can unmic yourself. You can be on camera, whatever you like. It's totally up to you. So I'm going to open the floor for any and all questions. Don't be shy. And while we're waiting for those questions, I can kind of pose this last question of what changes you see in the next 10 to 20 years in the industry. Feel free, Leslie or Angela, just take that question and run with it. And I'm going to keep my eyes open. There is a raise hand function, by the way. It is, I believe, under reactions. Yeah. If you go under reactions, you can raise your hand. You do whatever you like. I'm going to be looking for you, and we'll just keep it moving while we're waiting for your questions.
So the question was, what do we, I'm sorry.
What changes do you anticipate?
Yeah, over the next 10 to 20 years.
So I think for me, and whether I anticipate this or this is my hope, is that there are adequate supports in place for EMS agencies in rural Michigan and EMS professionals that ensure the health and longevity of the agency, and the health and well-being of and viability and support for the EMS professional. And so, you know, whether that's financial or it's, you know, community support for who you are and what you do, I anticipate that the work that we are doing and the fact that we are working more together to leverage our work in rural Michigan, that we can work towards some of these lasting changes and really get to the root of the problem, as opposed to slapping a Band-Aid on it like we've been doing with things like recruitment and retention. So I anticipate that those things will happen. I anticipate that we as an organization will you know, start to change culture and attitudes surrounding EMS and mental wellness and all those things. We want to ensure healthy future for rural EMS.
Yeah, I absolutely agree with what Leslie said. I will add one thing, and that is, I think as EMS providers, we've gotten into the habit of being the fixers, right? So we come upon a scene, we're called out, we just fix it and we move on. And we are not very good about telling our story or telling, you know, or asking for things that we need. If we have to do more with less, then we just have done more with less. I anticipate that changing in the next 10 to 20 years, mostly out of necessity, unfortunately. I would never wish this on anybody, but one public figure with one family member that doesn't get a timely response and everything changes. And so I think what I would anticipate for the EMS agency is for us to really introspectively realize that we need to do a better job of advocating for ourselves in a more personal manner, not just kind of waiting and seeing what we get.
Very good. Yeah. So
I agree.
Yeah. So I'm gonna actually thank everybody and stop recording. So